Hey guys, I am Jasmine and this is
Jessica.
And we are here with Inside Dental Edition. So, I know, you just got told you have a cavity! It's okay, you will not die. But, you must get it done. And here's the reasons why, and here's what to look out for, and how to know if you really have a cavity, because we know there's a lot of dentists out there who like to diagnose. Okay, so we're here to help you. So first things first, of course, x-rays are a huge help to let the doctor know if there is decay. Mm-hmm. They always take their little Explorer, which is the little pokey thing that pokes your gums, but it's poking your tooth. And that's usually to tell what, if it's soft?
Yes.
Okay, so if it's soft, if it's sticky, there's a cavity there. The next thing we do are called intraoral pictures. So they take a device inside the mouth and they take a few pictures, Kodak moment cheese, and then we wrap it up. So, as far as the cavity goes, there's a lot of things to look out with. Sensitivity is one, usually to sweets.
Yes, sweets. Anything hot or cold, or if you have a bad smell coming from that certain area. What else?
Those are usually the things I hear patients say, yeah. So mainly like sensitivity to sweets, hot and cold.
And pressure when you bite down.
Yeah, when you're biting down, and a little odor as well. So that's really some of the signs to look out for. And then once you get the diagnosis, a lot of times the intraoral picture, like you really can't tell there's a cavity there. So again, it's like you see a pretty girl who takes a picture, but inside she's very ugly. You know, that's kind of like how would we for a cavity? You know, it's a very ugly cavity inside the tooth, but the surface looks completely fine. So that is the importance of taking these x-rays. So once we take the x-ray, so on this picture here that we're about to pull up, you can see that the tooth looks normal. It does have a little bit of discoloration, but it looks very normal. Now we're going to slide over to the x-ray. So this x-ray here, if you can see, it shows a big spot of decay. So this is exactly referring back to how you can really tell there's a cavity with the intraoral picture, but the x-ray will show you that there is a cavity there. So another thing is, you know, how do I know if my doctor's diagnosing properly? These doctors have gone to school for a very long time. First things first is you have to be able to not only trust the doctor, but trust the clinical staff and your financial coordinator and the manager in the practice. I've assisted I've been in the dental field for about 13 years, and I can tell you I've seen it all from the back shady work to the front of overcharging and, you know, misleading patients with their insurance. So it's always best for you to really go to an office that you can trust, not only with your dental work, but your finances and your insurance as well, because we know that insurance is a huge help to us nowadays. So I always tell patients after we go over all their benefits estimates is another question that they like to ask a lot of us, and I know y'all don't only ask me, y'all not only going to ask the assistant or the hygienist, y'all ask the doctor, y'all are going to ask his assistant, y'all will ask the hygienist that saw you, and you will always ask your front office girl, which is I'm the last resort if I get to say, should you wait or could you wait? Jessica, what would you respond to that if someone was to say, could I wait on the small cavity?
I would say to get it done now, the sooner the better. Cavities don't stop growing. They will keep growing. There's just no telling when or why. It could be, you could come in let's say March, and then you come back for your next 6 month, and that cavity could have just blown up already. So there's just no telling. So with me, the sooner the better. You spend a couple, $80 with your insurance, and versus $1,000 for a crown. Yep. So the sooner the better, I would say.
Yep, for sure. So anytime that you are diagnosed a cavity, you always have the right to look at the x-rays, have the doctor deeply explain everything to you, because we understand before we were in the dental field, we didn't even know what an x-ray was. We didn't know what they were for, what they did, did they help, did they not help. The only thing I ever recall is people always saying is, I don't want to be exposed to radiation. That's all I would ever hear. But other than that, we didn't know about that. So make sure that you're being explained properly. And yes, of course, any cavity, no matter how small the cavity is, yes, go ahead and get it done. The sooner the better. The less expensive it's going to be on you, the less time consuming it will be as well, and the less damaging to other surrounding teeth, because cavities just kind of grow and spread. So that's really what I would personally recommend to any of y'all. So I hope y'all like this, and I hope this helped a little bit. Check us out on the next episode. Please leave your comments down below. If y'all have any questions or would like to talk about a certain topic, or if you have a question or if you're confused, let us be your dental girls and help you out. Bye.